Get ready for the Medicare for the Lazy Man podcast, the Medicare podcast for confused Americans. And now, fresh from his morning nap, Medicare expert Doug Jones.
Hello, everybody. Glad to see you. Are you ready to talk about Medicare? Well, I am. Even if you're not, you'll be brought to the table and fed a heaping spoonful of Medicare sugar because that helps the medicine go down or some such thing. I love to help people feel more confident about their approaching Medicare enrollment. And the way I do that is to offer them the opportunity to purchase my book, Medicare for the Lazy Man. And the current edition is 2024. There's going to be a new edition at some point, but we don't know when that's going to happen. So if you're looking for good, solid Medicare advice, purchase Medicare for the Lazy Man 2024. I would go to barnesandnoble.com or amazon.com and type that title right into the search window. And especially at Amazon, you're going to have some decisions to make after that. There are 4 different editions, all created with you, the reading audience, in mind. You've got the Audible book that is read to you. You've got the Kindle book that you can have downloaded to your device in very short order, almost immediate gratification. The paperback book at Barnes & Noble has beautiful colored illustrations. At Amazon, it has black and white illustrations as a tip of the hat to Jeff Bezos, who tries to charge extra for the colorful illustrations. I don't want to pass that cost on to the reader, so I make the illustrations black and white so that Jeff Bezos does not get his hands into my pockets, or your pockets, for that matter. And finally, of course, there is the Christmas present to end all Christmas presents, Medicare for the Lazy Man 2024 hardcover edition. It fits perfectly into a stocking, which you may then hang from a chimney with care, because Santa Claus will soon be there, except that Santa Claus will find that the book has already been placed in the stocking. In any event, I believe that that book will make an excellent Christmas gift for your loved ones, your relatives, and for the people on your list that may be difficult to purchase gifts for. So, speaking of difficult, there's Randy Carson sitting right across the screen from me. Hello, Randy.
Hey, Doug, you really just gave me a great idea.
What's that?
My grandkids have been, I've been thinking and thinking and thinking, what am I going to get them for Christmas? I think I'm going to get them a copy of your book.
Well, I'll tell you what, it's pre-autographed. Every copy is pre-autographed, and they will worship the ground you walk on. After you're long gone and they're old, and they'll still have those books, because if you give them the hardcover books, they're going to last forever. I've already purchased some for my grandparents, for Drew's 2 kids, and for other children that are on our Christmas list, and I'm sure they're all going to be so darn happy to get Medicare books.
Oh, I can guarantee it, because bottom line is my grandkids are probably not going to hit Medicare for a while yet. 60 some years in some cases, but
Yep.
they're going to go, oh, look at what Grandpa Randy gave me. I've got this Medicare book. And so bottom line, they're going to say, 'twas the night before Medicare, and all through the house, not a creature was stirring, not even a mouse.
Or a louse, if you want to talk
Or a
about
louse, or if you're talking about Medicare
Medicare
Advantage,
Advantage.
people.
Exactly
That's right.
right.
That's right.
Well,
Well, I gotta do my job here.
all right, but I will say that I know that this is true. What I say about the author of the book or the giver of the gift being remembered fondly is true, because my grandfather was a good friend of Earl Stanley Gardner, and we have a whole bunch of Perry Mason first editions that he autographed and sent to my grandfather every time a book came out. And so we revere his memory, and I'm sure that your memory will be revered by your grandchildren as well.
Yeah, I certainly hope so. I know that one of them was probably he was gonna take it to school and suggest that the teacher read it to the class.
Well, the teacher may not want to cooperate with that considering the subject matter, but you know something, I will encourage that to happen. If the teacher ever calls me and says, "What do you think? Is it appropriate for kids?" And I'll say, "Yes, it's appropriate for readers of all ages."
That's right. Absolutely. And I totally agree. So you're looking for me to pick a number. And I've got to tell you, Doug, before we got on the air this morning, I have given this serious consideration.
I know it's a big deal for you. Every week you go through a lot of mental prestidigitation in order to come up with the number. But what we have here, ladies and gentlemen, is a stack of articles, each of which addresses some of the shortcomings of Medicare Advantage plans. And our reading of these articles is an effort to warn our listeners to stay away from Medicare Advantage when it's Medicare time for you, because it never ends well. So,
I know.
Randy, after all that thought, what number did you find to come up?
Are you ready?
I am.
427.
Darn it. Boy, that's way deep in the stack. Hey, you tried to trick me.
Number 33.
Okay, number 33. I'm going to cross it off, and I am going to dig into the stack to see what number 33 has to tell us. Pardon me, ladies and gentlemen. If I knew some jokes, I would tell them at this time.
What's really interesting, folks, while Doug is weeding through his stack there, is you can't see him, but I can see him when he rolls in that stack on a two-wheeler. Okay, that's how it gets in his office.
I don't know how many trees had to die for us to be warned about Medicare Advantage plans, but it was considerable quantity. All right, I'm going to drop it over to the side of my desk. Number 33. The headline reads, "Are you in a Medicare Advantage plan? Double check that your providers are and will be in network for next year." A recent Health Leaders article, Health Leaders must be a publication. It was titled, "Providers Are Fed Up with Medicare Advantage." That article was published in September of 2024. It says all across the country, more providers, that means doctors, hospitals, other medical professionals that might treat you if you need medical treatment. More providers are opting to drop Medicare Advantage plans, creating a new trend within the healthcare landscape. The article cites a survey conducted by Healthcare Financial Management Association, which found that 19% of health systems, as hospitals and so forth, have stopped accepting Medicare Advantage plan, at least one Medicare Advantage plan. 61% are planning to or are considering stopping the acceptance of patients that have at least one Medicare Advantage plan. The survey also found that 82% of health systems are experiencing higher denials than they did in pre-pandemic times, highlighting arguments often made by provider organizations that end contracts with Medicare Advantage plans. Health Leaders article states, providers often argue that Medicare Advantage plans impose restrictions that can hinder patient care. Low reimbursement rates, complicated billing processes, and stringent pre-authorization requirements have pushed CFOs to their boiling point. The administrative burden and financial strain associated with Medicare Advantage plans is simply not worth it for many health systems. When they finally reach out for help, they all too often discover a grim reality. Many of the providers listed in their insurer's directory simply don't exist or are not accepting patients. This isn't a minor oversight. It's what is known as a ghost network, and it leaves countless people stranded when they need care the most. A ghost network. That's a new one on me. The author highlights several articles describing this and other health insurance problems, including, "I don't want to die needing mental health care." He got trapped in his insurer's ghost network. That was a September 8th, 2024 article. That particular article documents the plight of a marketplace plan enrollee, a Medicare Advantage plan enrollee, who bought a health insurance plan thinking it would deliver on its promise of access to mental health providers. But even after 21 phone calls and multiple hospitalizations, no one could find him a therapist. The annual enrollment period, which allows Medicare beneficiaries to make changes to their Medicare Advantage and Part D drug plans for the following year, starts in October. If you are enrolled in a Medicare Advantage plan or are considering doing so, make sure to confirm that your providers, your doctors, and so forth, are part of and will remain in the plan's network for the coming year. Unfortunately, there's no guarantee that a Medicare Advantage plan's network will not change during the calendar year. Wow. A poignant reminder that these plans change. When you buy a Medicare Advantage plan, it can change from what you thought you were buying to what it turns out to be, actually best for the management of the plan. It will morph itself into something that you didn't know that you were buying. Now, here's another kind of a related story. It is the Aetna Health Insurance Company sending out a notification to their Medicare Advantage clients, keeping you informed. Contract negotiations with Trinity Health continue. Now, this is dated 2 days ago, September 10th. December 10th of 2024. Trinity Health, I hadn't heard of too much. It turns out that Trinity Health is a Catholic health system that has 92 hospitals in 22 states. It has 120 continuing care locations. And the notification is our current network agreement with Trinity Health for Medicare Advantage plans for Aetna in all states is set to expire at the end of December 2024. We are in the midst of contractual renewal process and are working to reach an agreement. Please know that we take this renewal effort with Trinity Health very seriously, and we have been working towards a successful resolution for several months. We value the patient-provider relationship and the role it plays in enabling our members to receive quality health care that helps them live their healthiest lives. We strive to offer a robust quality network of hospitals, doctors, and other healthcare providers. Well, here's the interesting thing, ladies and gentlemen. That's Aetna's take on it. Trinity Health obviously probably has a different, they would word the description of their conflict a little differently, coming from a different perspective. However, the reality is that as of the recording of this episode, the AEP, the annual election period, the annual enrollment period, has ended. So if Trinity Health and Aetna cannot come to an agreement, and if they go their separate ways at the end of December, the people who have enrolled in an Aetna Medicare Advantage plan expecting that Trinity Health would be available and the doctors and the hospitals in the Trinity system would be available for them, those people purchased a pig in a poke. They're not going to be legally able to change Medicare Advantage plans. And Aetna, if it has to break ranks or break its relationship with Trinity Health, will still have those people, and they will still get tons of federal treasury money for having those members in their plan, even if the plan turned into something that those members did not want and would not have purchased because Trinity Health is not available to them. This could have been avoided if the contract negotiations were done prior to this, like let's say last summer. And then during the AEP, if Trinity Health wasn't there and that was important to many of their plan members, then they would be able to change plans legally during the AEP. But it was timed in such a way that there could be many victims of the circumstances of Trinity Health and Aetna parting ways and Medicare Advantage people being left out in the cold. One other good reason to avoid buying a Medicare Advantage plan in the future, because it can change to something that you aren't ready for, that you don't like, and that you wouldn't have bought if you hadn't been talked into it, sweet talked into it. Speaking of sweet talking, I like the idea of taking a commercial because I bet some of our sponsors are pretty sweet talkers themselves. So we're going to do a commercial break right now. All righty, we're back and we're proud. I think that was a James Brown song. I have correspondence from our clients, our wannabe clients, and our soon-to-be clients. This particular one says, it's got several. This was from a guy in Phoenix. He's a new client. And he signed up for a Medicare Advantage or a Medicare supplement plan, purchased from the yours truly, the Medicare for the Lazy Man Empire. And he went to his doctor's office and said, "Hey, I've got this new plan, United American, and I'm pretty happy with it because the broker, me, told me all this good stuff about it." And the doctor's clerk said, "We don't take that plan." And of course, he's back at me in a big way going, "Hey, how come you sold me a plan that my doctor will not accept for payment?" And I have to go into the explanation with my client, Terry, just like I have to with frequently with some other people. So where do I start this? Any doctor who accepts Medicare, and that's over 95% of all doctors, 100% of civilian hospitals, except for children's hospitals and mental hospitals and Kaiser. Otherwise, 100% of all hospitals in America accept Medicare with a Medicare supplement. And here's how you ask the question. You go to the clerk and you don't say the name of the company that you just bought a Medicare supplement from because they don't really care. No Medicare supplement has a network. So what you say is, "I have Medicare Parts A and B, plus I have a Medicare supplement. Is that okay for you to accept as payment for my treatment?" They never care about who issued the supplement. Federal regulations state that if Medicare approves the bill, the supplement will pay its share without question. So I numbered that as number one in my correspondence with Terry. And I believe that I should have chosen this paragraph instead. I believe this was what he wrote me first. He said, "I've called this other company to cancel my Medicare Advantage policy twice. The first time in the last week of October, the man gave me a cancellation number and told me I would get a letter from them notifying me that the policy was being canceled for 2025. Never got a letter. I called them again 2 weeks ago, and they told me it was canceled for 2025. I still have not received a letter from them. Is this normal? Do you think I have to be concerned that they are actually going to cancel my plan? Any suggestions or comments would be appreciated." And he said, "I have received everything that you promised from United American." And I said, "Well, when you look at the list, okay, this is out of order, but basically I explained to him that when you look at a list of accepted insurance companies, those are HMOs and PPOs. So when he went to that office clerk and said, 'Do you take my new insurance company, United American?' she looks at a list of the networks that they belong to. United American and no other Medicare supplement has a network. There are no networks in Medicare and no networks in Medicare supplements. When you ask an office clerk whether they take company X, she is thinking about which networks they are members of, and Medicare and supplements do not have networks." And then I said, "Oh no, this is Terry." He wrote, "I have been looking to find new internal medicine doctor for 2025. A couple of sites had both Medicare and United American for insurance options in the search field, but when I did the search, the results were 315 out-of-network doctors, and there was not one doctor listed who accepted United American. Am I going to have trouble finding doctors in hospitals?" I think I numbered this backwards. And I said, "No, you're not going to have trouble finding a network doctor because there is no network at all. Any doctor who takes original Medicare plus a Medicare supplement will happily take your insurance." That is the question to ask. Medicare plus a supplement. That is the question that you should ask. And frankly, that's just a thing that comes up all the time because new people are constantly coming into my world and joining Medicare, and they are flummoxed when they find out that they go to their doctor's office and say, "I've got this new company for Medicare supplement," and the doctor's clerk, who doesn't really do much except file her fingernails and hope that you go away, her answer is, "We don't take that insurance." And it turns out that she's full of crap because Medicare supplements are accepted everywhere that doctors accept regular Medicare. So do not fret. Do not fret. Here's a little piece of correspondence from Alicia. She says, "Hello, Doug. My husband Alan and I are big fans of yours." Ooh, I'm going to stick this back in the pile and maybe read it a couple more times during the rest of the year. She says, "You have helped us out quite a bit. For 2 years in a row, we have purchased your book. Unfortunately, I can't find our copy of the 2024 edition. I was thinking of buying another copy, this time on Kindle, but it occurs to me to ask, when is your 2025 edition scheduled? Thank you very much, Alicia." Alicia and her husband live in Tampa. And I answered, "Hello again. The government was late in releasing the changes that they had planned for 2025, so that makes me late in creating the following year's book. The 2024 edition was finally published on February 26th of 2024, and I swore never to allow that to happen again, to be that late in the year. But this year, some conflicting projects have arisen, and so I may be breaking that pledge. Here's the best news, though. If you do go ahead and purchase another book, and the Kindle is the cheapest version, Amazon will allow you to leave another verified purchase customer review. Knowing that you are tapping your toe with impatience will spur me on, so thanks very much for writing." I always enjoy hearing from Alicia. Okay, this is a notification from a company that I recently established a relationship in Wisconsin. The company has what I used to call the only Medicare Advantage plan that I don't hate. And for I think it was two editions of the Medicare for the Lazy Man, I was able to devote a chapter in the book to the only Medicare Advantage plan that I don't hate. And, that's kind of a strong word, but it's designed to attract attention. The Medicare Advantage plan that I referred to there was available in 35 states. And then it was sold to another company, and that company decided to take it off the market. I guess because it wasn't making them a lot of money. And part of that problem is because it wasn't well understood by people who might have been benefited greatly by knowing that this product was available for them. I used it to help one of my clients through a very, very difficult situation, and it worked out very well because she was in a highly unusual situation. So I then found out from Diane Omdahl that Wisconsin has an insurance company that offers this particular Medicare Advantage plan that I do not hate, and it is out there for sale in every corner, every nook and cranny of the state of Wisconsin. And I've got to figure out a way to tell Wisconsin people that it's there for them if they need it. The plan is called Medicare MSA. It's a Medicare plan with a pretty high deductible. It's about a $3,500 deductible. No, it's about a $5,000 deductible, but the insurance company immediately dumps a bunch of money into your account, bringing the deductible down to about, I think, $3,100 or $3,500 for the year. Don't quote me. I'm going to research it before I come back with accurate figures. But the interesting thing is that this plan will never ask any health questions, but the entry times are limited. There are only 2 times in your life when you can get this plan. And if you neglected to enroll in Medicare, as I know some people have, then you are allowed to enroll in this plan every fall from October 15th to December 7th in the annual enrollment period, which has just ended. And also you're allowed to enroll in this plan when you turn 65. So that first period of time, 3 months before, 3 months after, in the month of your 65th birthday, you could enroll in this Medicare Advantage plan called the Medicare MSA. Now, why might you want to do that? Well, for one thing, it is free of charge. For another thing, the Medicare MSA operates with the rules of Medicare, not the rules of Medicare Advantage. So if Medicare would have approved a particular treatment, then the Medicare MSA will also approve of that treatment. But you may generally be healthy, and you don't want to pay a premium for an insurance plan that you may never have to use. Medicare Supplement, even the ones I sell, do have a moderate premium, and you may balk at that. that may not be your cup of tea. Well, Medicare MSA has zero premium after the fairly hefty front-end deductible, during which time they will dump a bunch of money into your account that they start with your name on it, that you can withdraw for anything you want. Then the plan pays 100% of any necessary medical treatment for the balance of the year. So let's say that you've purchased the Medicare MSA on your 65th birth month, and you then accept the fact that it's going to have a deductible of about $5,000. You accept the fact that they're going to put about $2,000 into your personal account that you can withdraw anytime you want to. And you understand also that if you need medical treatment during the year, you're going to pay the deductible. And after that deductible is paid, the plan kicks in 100% of all the Medicare approved treatment that you're going to need. So let's say that you kiss a bus in the middle of summer. Well, you will then have the balance in the account to defray some of that big deductible. You're still going to have to eventually get a bill that includes a deductible of several $1,000s, and then any prior or any subsequent treatment would be paid at 100% for the balance of the year, assuming that Medicare would have paid for that treatment. Then the plan will pay 100% for that treatment, assuming the deductible has been met. It's a wonderful plan for certain people, and I plan on trying to figure out how to let everybody in Wisconsin know that if they screwed up and didn't enroll in Medicare when they should have, that the annual enrollment period is a great opportunity to redeem themselves with this Medicare Advantage plan that I don't hate. It is the best Medicare Advantage plan available, and it's not talked about very much because it's just not widely understood. Medicare MSA, if you live in Wisconsin and this applies to you, give me a call. Maybe you have your 16th birthday coming up or 65th birthday coming up, and you are not interested in buying a Medicare supplement plan. Maybe it's against your religion. Well, you let me know, and I will help you get a Medicare MSA plan instead, and it's going to be a terrific improvement in your insurance coverage, because the other option is no insurance coverage at all, and that's just not acceptable for people who are responsible. And I have another piece of correspondence that starts with number 2, so I know I've overlooked something here. Number 1. Good afternoon. This gentleman here, I call him gentleman in the loosest sense of the term. He got all excited. I sent him a Medicare supplement quote, and he said, I just finished reading your book. I am a male who was born in December of 54. I live in Bergen County, New Jersey. Up until last April, my wife was employed and I was using her insurance. All along, I had the Part A of Medicare from December of 2019, which I have never used. After she got laid off, I applied for and got my Part B dated May 5th of 2024, and I'm paying $175. So his Part B has been in force longer than 6 months. So he has gone out of his free guaranteed issue for Medicare supplement. He cannot get a guaranteed issue Medicare supplement anymore. So he says, I'm in very good health. I don't use any prescription drugs. Will you please make recommendations for a high deductible Plan G Medicare supplement and a prescription plan and a dental and vision plan as well? And I said, sure, I will. And I sent him all that stuff, and I explained it to him in a very voluminous email. And I said, okay, so here's all this great stuff I'm offering you. And then he said, hi, Doug. When I sent you the email, I did not get an answer as fast as I had wished, and that was my fault. Due to the fact that I lost my insurance when my wife got laid off last April, I was getting out of the allowed window to apply. I applied for ARP Plan G, and it would be effective on December 1st of 2024. He said, this plan is costing me $233 and has discounts for dental and discounts for eye care as well. In case you think that I should cancel that and get something else, please advise. I still need a drug plan, so on that one, I need help. And I said, Well, it was a pleasure speaking to you tonight. He and I had a long telephone chat. And I said, here's some information on the drug plan I suggested, which costs $0 per month. I also recommended the Medicare supplement plan, high deductible plan G, and it showed a great savings from the $233 that he's currently paying with his regular plan G to ARP those criminals, those thieves. And he said, okay, I want to apply for what you're offering me because it's a better deal. And I'm going to execute that application right now. And I said, good, we'll do it online and everything will be fine. And then there was a delay and I didn't know what happened. So the next day, Saturday, I got an email from him. He said, Doug, I talked to my doctor and a couple of friends that are doctors as well. They all said that the Mutual of Omaha, that was the company that I sold him a Medicare supplement from. I thought it was United American, but it was Mutual of Omaha. I said, or he said, his doctor buddies said that Mutual of Omaha does not have a strong presence in New Jersey and did not recommend it. Please do not go forward with the application. And I said, the only question to be asked about whether a provider, a doctor, clinic, or other practitioner accepts Medicare is with a Medicare supplement. If the answer to that question is yes, in other words, does the doctor accept Medicare with a Medicare supplement? If the answer to that question is yes, it does not matter what company issues the Medicare supplement. The people you consulted were only thinking in terms of Medicare Advantage, which has a network. The insured must use the network, not a Medicare supplement. Medicare supplements do not have a network. But, something, that guy ghosted me. He just went away, drifted away, either didn't read or didn't care about what I said. So he did not get to save all the money that I was prepared to save him. But you will be able to enjoy the rest of your day without Randy and I bugging you if Randy takes over and performs his duties, as I know he will.
I've got just a couple thoughts to share with you, Doug.
I'd like to share thoughts.
I consider it to be part of my responsibilities to come up with little catchy phrases, that people will remember.
You always make that great contribution. What do you have today?
So I came up with a new Medicare Advantage plan. First of all, a Medicare Advantage plan is Part C, which stands in my world, as you know, crap. That's what that stands for. But anyway,
Sure.
I dreamt up another interesting way to refer to a Medicare Advantage plan that might stick in people's minds a little longer. And it refers back to the prior approval thing that they try to use against you to save their money and delay your benefits. I'm going to call it the Dirty Harry plan.
Explain, please.
It's pretty simple. You think about Dirty Harry plan and the little subtitle beyond, below it.
What was
Do
that?
you feel lucky, punk?
Oh, yeah. Yeah. And
So
now that was preceded in the movie by, did he fire 6 shots or only 5?
You got it. So there you go. The Dirty Harry plan. Anytime a Medicare zombie of any sort, Medicare Advantage zombie of any sort, approaches you, just remember, Dirty Harry, do you feel lucky, punk?
Let's try that out and see how it flies. Let's run that up the flagpole a few times and see how it does.
I totally agree with you. Well, anyway, we got to land the plane. We're out of quarters, and it seems as though I'm always running out of quarters. But before we, really have to land the plane on 32 left, we're going to say, don't forget, you can reach out to Doug with the email address of dbj@mlmmailbag.com. Doug is licensed nationwide to help you with your Medicare supplement planning. Check our website out, medicareforthelazyman.com. We're coming down to the end, totally the end of 2024, and we need to win over and above the travel logs. So drop us a review wherever you're running through the internet. It will help because the numbers mean it all in our business. Last but certainly not least, thank you for joining us today. We always enjoy when you're here, and that's exactly where we like to have you. And I don't know why this is, but we always have to remind you that you have just spent about 32 and a half minutes with Doug Jones, the insurance guy from Oklahoma. No more. He's camped out in the high ground, actually the Nosebleed Mountains behind Cave Creek, Arizona, in his fortress of solitude. And I'm always responsible for gauging his altitude because he has to match his oxygen requirements. I'm going to put him in at about 12,340 feet.
Well, that's a little bit of an improvement from last time, and I'll take it. So thank you, Randy, and thank you, ladies and gentlemen, for joining us today. I'm hoping that you'll come back and join us again for our next episode. Bye-bye.